Officials are reintroducing capacity limits at restaurants, bars, retailers, and hair salons, along with grocery stores and pharmacies.
In fact, the only sectors spared are places of worship, wedding ceremonies, and funerals. For more on today's announcement and whether it's enough to stem the spread of Omicron, we welcome to CP24 Tonight Ontario Science Advisory Table Director Dr. Peter Jüni and Infectious Diseases Specialist Dr. Abdu Sharkawi. Thanks to both of you for making time for us on a Friday night. Dr. Jüni, I want to start with you. Is this a Hail Mary, or will these new measures actually work to stem the spread of Omicron?
We need to be aware of what we're talking about here. We need to blunt the impact of this wave, and that's what we're doing exactly with that. It's a combination of these measures with all of us doing the right thing. Every single change in attitude matters. Every single decrease in contact that you're doing, and you're selective in what you're doing. Every single, instant of really using your mask properly, all of that matters in addition to getting vaccinated.
I know, Dr. Jüni, you mentioned earlier this week here on CP24 that you had been in talks with the government, I guess, as the process and consultations were happening leading up to today. What took so long? We heard from the Premier just 2 days ago. This was like comparing bananas and apples, and here we are today. We've got a fruit basket all mixed together.
Oh, so first of all, to clarify that, I'm basically the guy in the background helping with science, and then I'm talking to the public a lot. A lot of the other aspects are being covered by my colleagues, Beate Sander and Steny Brown, the co-chairs, with discussions with the cabinet. I was with the cabinet only once in this entire time, just to clarify that. But of course, I've had ongoing discussions with the Chief Medical Officer of Health, and I'm, so glad to have him there where he is, because he completely understood, the challenges here. And the rest is now just really having people understand what's happening. And this included, of course, also the cabinet. It's really difficult to gauge first. This is like being at the tremendously, high point looking down. It's too abstract to understand how high up you are. That's the story we're talking about.
Dr. Sharkawi, I know in terms of a timeline, when restrictions have been imposed over the last 20 or so months, we had more of a clear idea, at least, of when things would either expire and then be extended or not. What's your opinion in terms of a timeline when it comes to these restrictions, specifically that are going to be going into place in the next just over 24 hours?
Well, obviously, this is a very fluid and rapidly evolving situation. So being able to predict, how well these restrictions are going to work, how quickly they may blunt the spike in cases that we're experiencing is very difficult to say. And therefore, it's impossible to predict really what the final impact is going to be in terms of what else needs to be done. And if we need to re-strategize in terms of every form of protective measure that we can take, including greater vaccine eligibility and deployment, and other modifications with respect to these public health measures. This is an unprecedented situation. And I think the mistake that we keep making is I think the decisions are not only coming late with respect to reacting to what's going on, I think they're being invoked in a way that is meant to be palatable to different segments of our community, as opposed to recognizing what the science is. COVID-19 doesn't really make any distinctions between weddings, funerals, restaurants, Raptors games, Leaf games, or whatever it might be. If you're going to apply rules with respect to capacity limits, you're going to apply any form of guidance, it's got to be principally based. It can't be based on the type of facility specifically, because that's what creates a lot of confusion for people. That's what I think creates difficulty and frustration, is because people wonder, what is the motivation behind these decisions? Is it really based on science and evidence, or is it based on something else? And I think we know the answer to that based on the last 4 waves that we've already experienced.
Dr. Sharkawi, I'm glad you mentioned palatable, because I think the word lockdown itself, it does enough to send most of us kind of into a deep depression. Is what we're seeing today lockdown light? Does it go far enough, or would you have wanted to see more restrictions?
Well, I don't like that word. I think what we really need to do is define for ourselves what's essential and what's non-essential. and understanding that essential may include being able to stay in touch and to bond and connect with our loved ones, and recognizing the importance of that, especially at this time of year, because so many of us have sacrificed our holidays repeatedly, and that has had a very detrimental impact on mental health and other things. But let's make no mistake here. We're talking about a situation where we can do the right things. We can do things that we know work, and that includes getting as many people vaccinated as possible. It's providing things that empower people to make decisions correctly. That means rapid tests that should have been deployed and free and widely accessible not 2 days ago, with people running out of time and lineups 3 hours long. But several months ago, when we knew that there was a utility to these tests, that they could inform safe behavior all over our community. We need to do more of that. And frankly, the idea that we're exercising arbitrary limits with numbers of 10 or 25 for an airborne disease in places like bars and restaurants, to me, just doesn't make any sense. We're doing this hoping that we can have people acclimatize to these restrictions. What we really need to tell people is, listen, we're going to give you the tools that you need to make smart decisions, to be able to limit your contacts and do it safely, and here's how you do it. That's where we need to have people buy in, and that's how we're going to get through this. It's not going to be through these restrictions in a stepwise fashion.
Dr. Uni, I want to give you the opportunity to respond. I saw you profusely shaking your head no. I don't know if that was with me saying lockdown light, or to the fact that these restrictions do or don't go far enough.
No, so first of all, I completely agree. This is not a lockdown. The point is, we know what works now, and we don't have to go back to curbside pickup, for example. We need to get to a situation, to a place where we have decreased the number of contacts by 50% on average. And this means structural measures. And this can well be that you differentiate between just different things, such as the ceremonial part of a wedding or a funeral. I don't have an issue with that at all. That's completely okay how it is. We do not know yet how much these measures actually now work. That's true. We don't know yet how much mobility will decrease. That's just a surrogate, a proxy for contacts, and we will carefully monitor that. The point, of course, is we need all these different tools. What we heard today is one part. Rapid tests are a part. We had to do the homework for rapid tests and then discuss it with all the colleagues in the province. That was basically a lot of work, and I'm glad that we now have had these rapid tests. It's not as straightforward that it was completely clear from the beginning how the performance was. I'm glad the performance will be great, and I would believe that it will also work for Omicron. This is great news. And of course, we will now just need to move on. None of this will be enough if we don't really speed up vaccination and get as many people vaccinated as possible. Also, a lot of disenfranchised people out there who still distrust the system, who haven't had the first dose. We need to be aware of that. Everybody who hasn't been vaccinated will get infected during the next few months. It can be weeks, perhaps a bit longer. It depends how successful we are. Everybody will need to get immune before this comes to a slow halt. That's what happens and what will happen. We gain a bit of time, and we now are able to move on, and we need to now just look forward, do the right thing. And I completely agree with empowering people. That's needed. We should not be in this sense of helplessness. We can do a lot. One thing that we haven't discussed yet is work from home whenever you can.
Yeah, we've got a lot of work to do. Joining us now in progress for this conversation as well, I've got Dr. Martin Betts. He's the Chief of Critical Care at Scarborough Health Network. Dr. Betts, thanks for being here tonight. Your hospital, Scarborough Health Network, kind of the ground zero for COVID patients in ICUs across this province in the last wave. Thankfully today, if the provincial numbers are correct, 150 or so COVID patients in our ICUs. How concerned are you that that number is soon going to rise and rise quickly? And do today's measures hopefully stop that from happening?
The challenge we face in the ICUs are that our ability to scale ICU capacity is really limited. And our foe, which is a virus, is growing exponentially. So we haven't seen, the cases that are going to come in the days ahead, which are really baked in, we haven't seen yet in the pandemic. And so we anticipate that because hospitalization and ICU admission is a very lagging indicator, the patients that are going to show up to my ICU and that of my colleagues over the days ahead have been infected in the most recent days, and we haven't seen them yet come in. We know that our healthcare workforce is tired. Even just the last 2 days, I've received calls from 4 hospitals asking to transfer patients into my hospital just because they don't have beds or staff to look after patients. So we know that things are strained at the present time, and our ability to scale at the pace the virus is certainly limited.
Dr. Betts, I know we've been obviously closely monitoring other countries who are dealing with this new variant. In terms of you at your hospital watching other countries deal with this, a lot of these countries who've had to deal with this sooner than we have here in Canada, talk a little bit about how that works for your hospital, for you as a doctor, and kind of creating a plan moving forward with this new variant.
You know, in all waves of the pandemic, Ontario's had an advantage because other regions have been ahead of us. You know, right now we're looking at South Africa, we're looking at Denmark, we're looking at the UK, and in fact, we're looking at Kingston, who's, you know, ahead of the areas like the GTA and other places in Ontario. You know, we know that the virus behaves relatively similarly, whether it's Omicron, whether it's Delta, what we use to treat it is going to be the same. And so these geographic areas are giving us a guide on not only what to expect from a volume perspective, what to expect in terms of how patients respond to the illness and how severely they present. Certainly my reading of the places I've mentioned tells me that ICU cases are going up. They may not be going up as rapidly as in prior waves, but they're certainly going up in all regions, and that concerns me.
Dr. Betts, what's the plan here? Last wave, we had Cortellucci Vaughan Hospital to put patients. That hospital is now kind of off limits. It's running its own operation. We were kind of putting patients to Kingston, for example. Kingston very much now struggling with Omicron. So where do we transfer patients?
You know, the critical care system in Ontario runs as one complex integrated system. So we anticipate in Scarborough that this round, because we've had a fantastic vaccination rate in our community, we know our community's been hit in the past, that we may be the center that's taking patients in, and we're fully prepared for that. So wherever a patient needs an ICU bed, if it exists in Ontario, we'll find it for them. This time it's a little bit different in terms of where it's started, but we'll find a bed wherever we can and really until we can't.
Dr. Cherkaoui, I'm curious with this lowering of indoor capacity limits to 10. Do you think it would have been reasonable to tell people, and there's many people who are watching us tonight who are still going to say, look, I'm having my 25 people over, whether the provincial officials like it or not. Do you think it would have been reasonable to say it's either 10 or everyone who's coming to your house is taking a rapid test before they walk through that door, and if they test negative, that could be okay too?
Yeah, I think it's challenging to be exceedingly dogmatic about these sort of things when you're talking about sheer numbers. And I think people have a difficult time digesting numbers as a rule of law. And I think it creates confusion, and it leads people to want to say maybe a little bit more is fine. And truthfully, the arbitrariness of it is something that I don't really like. I've never really liked it, even in terms of the whole bubble concept. I think more importantly is trying to have people follow a principle that says, look, I want to limit this to as small a number of people as possible. And let's try and bear in mind, who are those people? If they are people that are elderly, immune compromised, maybe you want to separate them from any form of gathering that includes those that are perhaps less at risk, or maybe those that are not fully vaccinated, for example. You want to do things in a way that hopefully protects those that are most vulnerable. You want to optimize the use of rapid tests before and after. And I think we want to really impress upon people something that hasn't been impressed enough, which is that surgical masks are probably not very good anymore. They probably haven't been for a very long time, knowing that this is an airborne virus. We need as many people to be wearing airborne protective equipment, and that means N95 or KN95 type of filtration. Those are things that can be helped and disseminated and distributed and made affordable for people, just like rapid tests. And I think those things are much more beneficial and much more helpful than telling people that this is the number that's probably safe or it isn't, because it's completely arbitrary here.
Dr. Uni,
there are a lot of issues that I would need to contradict here. May I?
Go ahead. Yeah,
Absolutely.
we saw you adamantly shaking your head there.
Look, it's really important to give people clear rules. This rule of 10 is a clear rule. We need to be aware of that. We need to keep the gatherings as small as possible. I'm very glad if it's below 10. 10 is just a rule. We can't have something, oh, here you can do a bit more or a bit less, first thing. Second thing, rapid tests are great, but they're not a magic bullet. They mitigate the risk a bit, but the point is, again, if you have all a negative rapid test, this doesn't mean that you can't have a super spreader events, because this virus is actually just a very, very dynamic. So keep the gathering small, plus do a rapid test. That's what is needed. Third, it's not true that...
I just want to respond to that quickly, Dr. Uni, and I want to clarify. By no means am I suggesting that we should allow as many people as possible. I obviously want to recommend smaller gatherings. And I also want to point out that rapid tests that are done on 2 consecutive days do have very good predictive value for a decreased risk of transmission. So I wouldn't say they're not helpful, particularly if you're suggesting.
Of course they are helpful.
They remain masked indoors as well. So I think, in conjunction, they're actually very useful.
Dr. Uni, finish your thought.
That's
Go
okay.
ahead.
So, of course, they are helpful, but you said it on 2 consecutive days. There will be very soon a moment when we run out of rapid tests, so we need to be selective how we use them. That's important. The third thing regarding the masks, it's about having the best masks we can possibly get. A medical mask that is well fitted, or a combination of a medical mask inside and a 2-layered cloth mask on top, is actually completely okay. We will need KN95s, for instance. That's the cheaper version of an N95 for people like bus drivers, people on a cashier or so. That would be great if we do that. But the point is, we just try and are pragmatic and do it as good as it gets. We can't have bandanas, scarves, single-layered masks. That's nonsense. We can get better there, and we just try to get as good as it gets. The point is, we need to be pragmatic, because the sheer number of cases coming will be large. And the last part, perhaps, just regarding ICUs, people need to be very clear. We will need to look again now, and are looking already at triage protocols.
Dr. Betts, that begs the question, is that something you're concerned is going to happen? We heard the warning it was going to happen in wave 3, 4, and now Dr. Uni is saying that terrible word again, triage. Is it something that you're concerned about is going to happen?
I mean, that would be a huge blow to our society. It'd be a huge blow to our healthcare staff if we had to invoke triage protocols. But the reason we do so is because we're trying to provide the most good and the most benefit to our community as a large. So if it gets to that, we'll do so. They've been developed with lots of thought, care, and consideration that we can use all of our resources to best advantage and get as many people through the pandemic and through their critical illness as we can. And if it gets to that, they'll certainly be on the table. I certainly hope we don't get to that. And the more we can do at this stage to limit the number of cases, to limit the number of spread, the less we'll have to start to consider that.
Yeah, something I think all Ontario residents are obviously hoping for as well. Dr. Betts, Dr. Uni, Dr. Sharkawi, thank you all for joining us tonight.
Thank you.
Thanks a lot.